October 1st, it marks the start of Breast Cancer Awareness Month. And each year, the focus turns to the fight against a disease that continues to affect thousands of women and their families as well. But just how serious is the situation here in South Africa, and what more needs to be done to raise awareness and also just ensure early detection? Joining us to discuss this is breast cancer expert Professor Carol-Ann Benn and survivor Lydia Staats. Good afternoon to the both of you, and thank you for your time with us here on the SABC.
Good afternoon. Thanks for having me.
It's great. Yeah.
Thank you, Lydia. Thank you, Prof. Carol. Prof. Carol, let me start with you. Each October, we talk about breast cancer awareness. But beyond the campaigns, perhaps we could look at the stats and the lived reality, how serious and dire the situation is across South Africa. Could you paint that picture for us, please?
I think the reality is far worse than actual statistics, because remember, to be diagnosed with a breast cancer and to be registered as a cancer person, it means that you have to have had a diagnosis made either by a needle biopsy or a surgical biopsy, and sadly, it should only be by a needle biopsy. So what we see does not necessarily reflect how big the problem is out there. I think October is going to start with one of my favorite ladies, Lilian Dube's 80th birthday, and she has had 2 diagnoses of breast cancer. I've had the privilege of treating her over a long period of time, and she's such an icon to push the fact that this is a disease that affects all people, women, men, okay, people of all ages, people of all races. So it's a big problem, and it's a problem that the importance of media awareness of just the simple your breast and know where you can access care is very important for all people in our country. I mean, I'm just coming back from Rustenburg, where I run a small minds clinic, and it's really important for help for people.
Yeah, well, Prof, I mean, even if we expand a little bit further on the issue of early detection, perhaps you could speak to some of those barriers towards that. Is it cultural stigma? Is it lack of awareness or education or access? Is it lifestyle choices as well? Talk to us about what are those barriers at this point as well?
The biggest barrier, I think, is access to care. So people are not ignorant, but they might ignore problems because of the concern of not knowing what to do or where to go. So if you have a breast lump or you have a problem, you then have to seek help. You've got to go to a local clinic. You then need to go from there to make a diagnosis, and then it's only really in the urban areas that we have access to oncology treatment, surgery, and very little access to radiation. So the more awareness we can do about examining your breast if you've got a problem, and it's not difficult. It's finding a clinic, making sure people take seriously the fact that you can be 23 with a breast cancer. How you make the diagnosis is not difficult. With our advent of AI technology, we can do AI ultrasound, needle biopsy, the results can be read digitally, and then we can access into the right oncology treatment. So for me would be the biggest concern that I see that affects the country and in Africa as well.
Thank you for those opening remarks and perhaps setting the scene, because I want to bring in Lydia now. Lydia, if you can hear us, a very good afternoon, and thank you for your time. Prof has spoken about the context that we found ourselves in a South African society, perhaps also what we should be looking out for. But as a survivor of stage 3 breast cancer, what's your journey been like? When did you realize something was off? What were the decisions from then to for you in your treatment and the way you were going to approach?
Okay, so I woke up one morning, the end of November 2021, and I felt I had a pain in my, well, what I thought was in my chest. And at the time, my husband was admitted in a hospital with a blood clot in his lung, and it started with a pain in his chest. And he was admitted just 2 days prior to me waking up with this pain. And I touched where the pain was coming from, and I realized, hang on, this is in my breast. It's not my chest. It's my breast. And I felt there was a lump. So first what I did was I went to Dr. Google. I think a lot of us are guilty of that.
Yes.
And Google told me that breast cancer is not painful, that a cyst is painful. So I thought, okay, well, maybe it's a cyst. And I also read that you can get a cyst like just before your menstrual cycle. I thought, okay, well, I'm due next week. Let's see what happens. So I just kept quiet. And at the time, my older daughter was in matric. So I didn't want to stress anyone out. So I just kept quiet. But during that day, the pain just got worse. It actually felt like a hot coal burning in my breast. So I went to the pharmacy, and the pharmacist was known with our situation with my husband. And he said to me, well, you know what? I don't really know what to do for you, what to give you, because you're actually supposed to see a doctor. He said, but I'm going to give you an anti-inflammatory pill. It should help for the pain. But if the lump doesn't go away, you must go see a doctor. So I took these pills and the pain did go away. But, you know, a little voice in the back of my mind was, you know, kept on nagging me. Get this checked out. Don't just leave it. And even, you know, I had family saying to me, but breast cancer is not painful. But I felt like, no, I have to listen to my body. And I didn't know where to go, what to do. Like Prof says, a lot of, you know, when you're a government patient, you don't know where to go. And fortunately, I have a friend who has a daughter who works in a radiography department at a hospital. And I contacted her and I said to her, you know, how much is a mammogram? Because I found this lump in my breast. And then she contacted me and she said to me, you know what? I've spoken to my boss, who's the doctor here. She said, come in next week. We'll do an ultrasound on you pro bono, just to see, you know, is it something to worry about? Do you need more tests, or, you know, it's nothing to worry about? So that helped. And I went the next week. I went for the ultrasound and the doctor was like, quiet. She just printed out the pictures. She checked both sides and my armpits, both. And she said to me, you'll have to go for a biopsy and a mammogram. And I said, but I don't have medical aid. And she said to me, well, you go to Helen Joseph Hospital because they have a breast clinic there and they have the best breast specialist. So I waited a few more days and then my husband was discharged and I told him about this. And I said to him, but you know what, just be positive with me. I believe this is nothing to worry about. And eventually when I did Google the Helen Joseph Breast Clinic's number and I phoned, the lady who answered said to me, unfortunately, we already closed for December, because now this was now already in the middle of December. And she said to me, they open on the 18th of January, then I should come, you know, with my ID and that, which I did. Then I saw a doctor, booked mammogram, and went for my mammogram, February 2022, had a biopsy that day, and I was diagnosed with breast cancer 24th of February 2022. And by then it had already spread to my lymph nodes, so I needed to go for chemotherapy. I started chemotherapy March. I had 8 sessions of chemotherapy in a period of 6 months. It's every 3 weeks. And then, I finished September with my chemo, and I had a mastectomy with lymph node removal November 2022. And although my results came back, you know, all margins were clear, I needed to go for radiation.
Yeah.
So unfortunately, at the Charlotte Maclechler Hospital, they had an 18-month backlog on radiation.
Yep.
And I was placed on a waiting list, which was quite scary because my medical oncologist said to me, you know what, your cancer is high risk to come back, whether you have radiation or you don't have radiation, you know. So that was very scary for me, but, you know, I stayed positive, started volunteering in a breast clinic close by, not far from me. And when I went for my 6-month post-op routine mammogram,
Yes.
May of 2023, they found a suspicious looking lymph node again. and did a biopsy. So, and I said to my husband, I said, I'm not doing chemo again. If this is cancer, I'm not doing chemo again. Got my results June 2023. It was cancer. I had a recurrence due to the fact that I didn't have radiation. Same cancer came back in a lymph node in my armpit. And I had to start all over again. I had to do chemo again. I had to go through surgery again. But you know what? At the time, I was very depressed with my second diagnosis. For me, the second diagnosis was worse than the first time.
Sure.
I think because, you know, you hear these things being told to you that, you know, every time cancer comes back, it's more aggressive.
Yeah.
So now this was my second time. So I was thinking, you know what, is this cancer anywhere else? And while I was doing chemo again, my oncologist sent me for a CT brain scan and what they call a CT scan with staging, as well as a bone scan. So I was very fortunate, very blessed that it didn't spread to any other organs. All my scans came back clear. It was just in the lymph node.
Lydia.
So in September, yes.
No, I can see and we appreciate how vulnerable you are in sharing your story and you know, how you've also taken it upon yourself to also educate other people in communities about, you know, breast cancer. And Prof. Carol, you know, we're listening to Lydia's story and how she's showing up, you know, really just showing her own journey, the setbacks, you know, having to deal with it yet again when the second round came through with the news. The narratives around breast cancer that need to be, you know, repurposed. And Lydia's obviously trying to advocate for that as well. But if we're looking at some of the issues that she's highlighted, the backlog when it comes to radiation treatment for breast cancer patients, how do these delays ultimately affect a patient's chance of survival or patient's chance at a second shot?
So I think what's important is to look at Lydia's story and realize a couple of things. So the first important thing, the concept that you can't do care in December, and very much of a grace, it's not Monday to Friday. When people have to wait for 4 to 6 to 8 weeks to months to accessing care, it's what I highlighted at the start. The biggest problem in this country is something that is a really fairly easy to digest and pick up is something that's not. So the type of Lillian cancer that I had was an inflammatory cancer, which is the reason why I required a mastectomy. It presents as a red hot inflamed breast and is often missed as a cancer, and it's one of the few that's painful. The next thing is that there's a misconception that if you have a mastectomy, you can avoid this radiation. It's not like that. Very few cancers that require mastectomy. That's one of them. But today, if there's cancer in the glands, you need radiation. So what we need to do is make sure something that's a machine-based treatment, of which we do have machines, and many of them in our urban environment are utilized, whether they're in private or government, to make sure that people get treatment. All cancers should be discussed in a multidisciplinary environment, and the treatment is invariably not difficult, picked up early, and the outcomes are usually really good. So it is amazing that she goes out there and she offers some hope and awareness. She's doing super well. I'm so pleased in terms of a story, but there's so many ways that the journey might have been easier just by
Prof. Carol,
to access to sensible and not difficult care.
Prof. Carol, we are struggling a little bit with your signal, but we have come to the end of the interview. I just want to, as a parting shot, literally 30 seconds, how do people access more information and perhaps find out more, particularly as we start, you know, October 1st, and we highlight what breast cancer is all about in the country?
So access to good care, you can access the Breast Health Foundation. I'm fortunate to be in charge of a really good breast cancer council at the moment. We're looking at what's good in Africa and how to make particular awareness for African women. So I think go for the international site or the Health Foundation, like Cancer Society, to access information and with your bodies to make sure that you do your best to make sure you get the best treatment possible.
Prof. Carol-Ann Benn, thank you for your time, and thank you, Lydia Staats, as well, for joining us and for poignantly sharing your story to date, and perhaps also assisting all those around you, given your own journey. We're going to have to leave the conversation there. Breast cancer expert Professor Carol-Ann Benn and cancer survivor Lydia Staats weighing in. Of course, we know October 1st marks Breast Cancer Awareness Month. We're just talking about the realities in South Africa and perhaps some of the breakthroughs with relation to that treatment as well.